Top 30 ICU nurse interview questions and answers. Working as an ICU nurse requires advanced clinical knowledge, emotional resilience, quick decision-making, and excellent communication skills. ICU nurses care for critically ill patients, often in life-threatening situations, where accuracy and calmness are essential. Interviews for ICU nursing positions are designed to test not only your technical skills, but also your ability to handle pressure, teamwork, and patient advocacy. In this video/article, we will cover the top 30 ICU nurse interview questions and answers with well-structured, professional responses to help you confidently prepare and succeed in your ICU nurse interview. 1. Why did you choose to become an ICU nurse? I chose to become an ICU nurse because I am passionate about caring for critically ill patients and making a meaningful impact during their most vulnerable moments. The ICU environment challenges me to continuously improve my clinical skills, critical thinking, and decision-making abilities. I enjoy working with advanced medical technology and collaborating closely with physicians and multidisciplinary teams. Most importantly, I find fulfillment in supporting patients and families through complex, life-threatening situations while delivering compassionate, evidence-based care. 2. What skills are most important for an ICU nurse? The most important skills for an ICU nurse include critical thinking, strong clinical judgment, attention to detail, and effective communication. ICU nurses must quickly assess patient conditions, interpret complex data, and respond to emergencies calmly. Technical skills such as ventilator management, hemodynamic monitoring, and medication administration are essential. Emotional resilience and empathy are equally important, as ICU nurses support patients and families during stressful times. Teamwork, adaptability, and time management also play a key role in providing safe and high-quality care. 3. How do you handle high-stress situations in the ICU? I handle high-stress situations by staying calm, focused, and organized. I prioritize tasks based on patient acuity and rely on established protocols to guide my actions. Deep breathing and clear communication help me remain composed during emergencies. I also work closely with my team, knowing that collaboration improves patient outcomes. After stressful situations, I reflect on my performance and seek feedback to improve. Maintaining a healthy work-life balance and practicing self-care also help me manage stress effectively. 4. How do you prioritize care for multiple critical patients? I prioritize care by assessing each patient's condition, stability, and immediate needs. Life-threatening issues such as airway, breathing, and circulation always come first. I use clinical judgment, monitoring data, and physician orders to determine urgency. Effective time management and organization allow me to anticipate patient needs and prevent complications. I also communicate with the healthcare team to delegate tasks when appropriate. Reassessing priorities frequently ensures that all patients receive safe and timely care. 5. How do you handle a patient's family in emotional distress? I handle emotional family members with empathy, patience, and clear communication. I listen actively to their concerns and acknowledge their feelings without judgment. Providing honest, understandable information helps reduce anxiety and builds trust. When appropriate, I involve physicians or social workers to offer additional support. I maintain professionalism while showing compassion, ensuring families feel respected and informed. Supporting families emotionally is an essential part of ICU nursing, as it helps them cope during difficult and uncertain times. 6. How do you respond to a sudden patient deterioration? When a patient deteriorates suddenly, I act quickly while remaining calm. I immediately assess airway, breathing, circulation, and vital signs, then initiate appropriate interventions. I notify the physician and call for additional support if needed. Following ICU protocols ensures rapid and effective response. Clear communication with the healthcare team is essential during emergencies. After stabilization, I document events accurately and reflect on the situation to identify learning opportunities and improve future responses. 7. What experience do you have with ventilator management? I have hands-on experience managing patients on mechanical ventilation, including monitoring ventilator settings, assessing oxygenation, and identifying signs of respiratory distress. I regularly collaborate with respiratory therapists and physicians to adjust settings based on patient condition. I closely monitor arterial blood gases, lung sounds, and patient comfort. Ensuring proper suctioning, oral care, and infection prevention is also a priority. My goal is to maintain optimal ventilation while supporting patient safety and comfort throughout their ICU stay. 8. How do you ensure patient safety in the ICU? I ensure patient safety by strictly following hospital policies, infection control guidelines, and medication administration protocols. I double-check high-risk medications, verify patient identification, and closely monitor vital signs and equipment. Regular assessments help identify early signs of deterioration. Clear documentation and effective communication with the healthcare team reduce errors. I also educate patients and families when appropriate. Maintaining vigilance and attention to detail is essential in the ICU, where patient conditions can change rapidly. 9. How do you handle medication errors or near misses? If a medication error or near miss occurs, I immediately report according to hospital policy and inform the appropriate team members. Patient safety is always my top priority. I assess the patient for any adverse effects and take corrective actions as needed. I believe in transparency and learning from mistakes. Participating in root cause analysis helps prevent future errors. I also reinforce safe medication practices, such as double-checking dosages and labels to minimize risks. 10. How do you communicate with physicians during critical situations? During critical situations, I communicate clearly, concisely, and confidently using structured tools like SBAR. I provide accurate patient information, including vital signs, assessment findings, and recent changes. Effective communication helps physicians make quick, informed decisions. I also actively listen to instructions and clarify orders when necessary. Maintaining professionalism and teamwork ensures smooth collaboration. Clear communication in high-pressure situations is essential for patient safety and positive outcomes in the ICU. 11. How do you manage end-of-life care in the ICU? I approach end-of-life care with compassion, respect, and dignity. I focus on patient comfort, pain management, and emotional support. Clear communication with families helps them understand the situation and make informed decisions. I respect cultural, religious, and personal values during care. Collaborating with palliative care teams ensures holistic support. Supporting families during end-of-life moments is emotionally challenging, but it is one of the most meaningful responsibilities of an ICU nurse. 12. How do you stay updated with ICU nursing practices? I stay updated by attending continuing education programs, reading nursing journals, and participating in training workshops. I also follow evidence-based guidelines and hospital protocols. Learning from experienced colleagues in multidisciplinary rounds helps enhance my knowledge. I actively seek feedback and reflect on clinical experiences. Staying current with best practices ensures I provide safe, high-quality care. Continuous learning is essential in ICU nursing due to rapidly evolving medical technologies and treatment approaches. 13. How do you handle conflicts with team members? I handle conflict professionally by addressing issues calmly and respectfully. I listen to different perspectives and focus on finding solutions that prioritize patient care. Open communication helps resolve misunderstandings quickly. If needed, I involve a supervisor or follow hospital conflict resolution procedures. I believe teamwork and mutual respect are essential in the ICU. Resolving conflicts effectively helps maintain a positive work environment and ensures smooth collaboration during critical situations. 14. What experience do you have with critical monitoring equipment? I have experience using various ICU monitoring equipment, including cardiac monitors, infusion pumps, arterial lines, and central venous pressure monitors. I regularly interpret data such as ECG rhythms, blood pressure trends, and oxygen saturation levels. Early detection of abnormal readings allows timely intervention. I also ensure equipment is functioning properly and troubleshoot alarms promptly. Proficiency with monitoring equipment is essential for providing accurate assessments and ensuring patient safety in the ICU. 15. How do you manage time during busy ICU shifts? I manage time by staying organized, prioritizing tasks, and planning ahead. I assess patient needs at the beginning of the shift and adjust priorities as conditions change. Effective communication, and teamwork help distribute workload efficiently. I cluster care when possible to minimize interruptions. Staying flexible and focused allows me to handle unexpected situations. Good time management ensures that all patients receive timely, high-quality care even during the busiest ICU shifts. 16. How do you handle a patient who is anxious or agitated? I handle anxious or agitated patients by first identifying the underlying cause, such as pain, fear, or hypoxia. I speak calmly, provide reassurance, and explain procedures clearly. Non-pharmacological interventions like repositioning and a quiet environment often help. If needed, I collaborate with a physician for medication adjustments. Ensuring patient comfort and safety is my priority. Compassionate communication can significantly reduce anxiety and improve patient cooperation. 17. How you ensure accurate documentation in the ICU. I ensure accurate documentation by recording assessments, interventions, and patient responses promptly and thoroughly. Clear documentation supports continuity of care and legal compliance. I use standardized terminology and follow hospital guidelines. I double-check entries to avoid errors or omissions. Accurate charting is essential in the ICU, where patient conditions change rapidly. Proper documentation also helps the healthcare team make informed decisions and improves overall patient safety. 18. How do you handle constructive criticism? I view constructive criticism as an opportunity for growth. I listen carefully, remain open-minded, and ask questions to better understand feedback. I reflect on my performance and apply suggestions to improve my practice. Accepting feedback helps me develop professionally and enhance patient care. I also appreciate feedback from colleagues and supervisors, as continuous improvement is essential in the ICU environment. A positive attitude toward criticism strengthens teamwork and nursing excellence. 19. What would you do if you disagree with a physician's order? If I disagreed with a physician's order, I would respectfully express my concerns and provide clinical evidence or patient observations to support my viewpoint. Patient safety always comes first. Open communication and collaboration help resolve differences effectively. If needed, I would escalate the issue following hospital policy. Professional dialogue ensures that decisions are made in the patient's best interest while maintaining mutual respect within the healthcare team. 20. How do you prevent ICU-acquired infections? I prevent ICU-acquired infections by strictly following infection control protocols, including hand hygiene, sterile techniques, and proper use of personal protective equipment. I ensure timely catheter care, ventilator bundles, and regular patient repositioning. Monitoring for early signs of infection allows prompt intervention. Educating patients and families about infection prevention also helps. Consistent adherence to evidence-based practices significantly reduces infection risks and improves patient outcomes in the ICU. 21. How do you deal with emotional burnout? I manage emotional burnout by practicing self-care, maintaining work-life balance, and seeking support when needed. Talking with colleagues and participating in debriefings helps process difficult experiences. I focus on stress management techniques, such as exercise and mindfulness. Recognizing early signs of burnout allows timely intervention. Taking care of my mental and emotional well-being enables me to continue providing compassionate, high-quality care to critically ill patients. 22. How do you educate patients or families in the ICU? I educate patients and families by using simple, clear language and avoiding medical jargon. I assess their understanding and address their concerns patiently. Providing written materials or visual aids can be helpful. Education empowers families to participate in care decisions. I ensure information is consistent with the care plan and physician guidance. Effective education builds trust, reduces anxiety, and improves overall patient and family satisfaction in the ICU setting. 23. What experience do you have with code situations? I have participated in multiple code situations, including cardiac and respiratory arrests. I am familiar with ACLS protocols and understand my role during emergencies. Staying calm and following established procedures ensures effective teamwork. I assist with CPR, medication administration, and monitoring patient responses. After the code, I participate in documentation and debriefing sessions. Code experience has strengthened my ability to perform under pressure and prioritize patient survival. 24. How do you handle ethical dilemmas in the ICU? I handle ethical dilemmas by following hospital policies, professional nursing standards, and ethical guidelines. I advocate for the patient's best interests while respecting family wishes and legal considerations. Open communication with the healthcare team helps resolve complex issues. If needed, I involve ethics committees or supervisors. Ethical decision-making in the ICU requires compassion, professionalism, and a commitment to patient dignity and safety. 25. How do you adapt to new ICU protocols or technology? I adapt quickly by actively participating in training sessions and asking questions when needed. I review guidelines and practice skills to ensure competence. Staying flexible and open to change is essential in critical care. I collaborate with experienced colleagues to learn best practices. Embracing new protocols and technology improves patient outcomes and enhances efficiency. Continuous adaptation is a key part of providing high-quality ICU care. 26. How do you maintain patient dignity in the ICU? I maintain patient dignity by respecting privacy, explaining procedures, and involving patients in care decisions whenever possible. I ensure proper coverage during procedures and speak respectfully at all times. I advocate for patient comfort and cultural preferences. Maintaining dignity builds trust and promotes emotional well-being. Even in critical conditions, patients deserve compassionate, respectful care that acknowledges their humanity and individuality. 27. How do you manage pain in critically ill patients? I manage pain by regularly assessing pain levels using appropriate scales and observing nonverbal cues. I administer prescribed medications safely and monitor effectiveness. Non-pharmacological methods, such as repositioning and comfort measures, are also used. Collaboration with physicians ensures optimal pain control. Effective pain management improves patient comfort, promotes healing, and reduces stress in critically ill patients. 28. How do you handle sudden changes in patient condition? I respond to sudden changes by reassessing the patient immediately and identifying potential causes. I initiate appropriate interventions and notify the healthcare team promptly. Continuous monitoring and vigilance help detect early warning signs. Staying calm and following protocols ensures quick, effective responses. Managing sudden changes is a core responsibility of ICU nursing and directly impacts patient outcomes. 29. Why should we hire you as an ICU nurse? You should hire me because I am dedicated, skilled, and compassionate. I have strong critical thinking abilities, clinical expertise, and the ability to remain calm under pressure. I value teamwork and effective communication. I am committed to continuous learning and patient safety. My passion for critical care and patient advocacy drives me to provide high-quality, evidence-based nursing care in challenging ICU environments. 30. Where do you see yourself in 5 years as an ICU nurse? In 5 years, I see myself as a highly skilled and experienced ICU nurse, possibly pursuing advanced certifications or leadership roles. I aim to mentor new nurses and contribute to quality improvement initiatives. Continuing education and professional growth are important to me. I want to remain dedicated to critical care while expanding my knowledge and making a positive impact on patient outcomes and team development. Preparing for an ICU nurse interview can feel overwhelming, but confidence comes from knowledge and practice. These top 30 ICU nurse interview questions and answers are designed to help you understand what interviewers look for and how to present yourself professionally. Focus on clear communication, patient safety, teamwork, and compassion. With the right preparation and mindset, you can successfully showcase your skills and passion for critical care nursing. Best of luck in your ICU nurse interview journey and future nursing career.